We are joined right now by Ramachandran, the chair of the IOHA Conference Planning Committee. Thank you so much for being with us today.
Thank you very much for having me.
So the first question I wanted to ask, for people that aren't very familiar with the IOHA conference, can you tell us a little bit more about the conference itself? And in particular, I know that it's an international conference. But, other than the fact that we have attendees from all over, how do we really emphasize that international aspect?
Okay, so the IOHA conference, for those of you who are not familiar, it's an international occupational hygiene conference, and it differs from, let's say, the AIHCE in the sense that it is focusing on occupational health problems throughout the globe. And many parts of the globe may not be up with the latest cutting edge of occupational health, but they still have serious occupational health issues.
Sure.
And part of the goal is for people in the developing world to learn tools that have already been problems that have been already solved and use those tools to solve their in-country problems. And at the same time, people in the developed world would, I guess, learn about the issues that are still there that we think we have solved, but very much present for vast majority of the world.
So all of the education is really focused on the globe and the whole world.
Yes. So for example, it's not as if we still have the traditional occupational hygiene topics on risk reduction, exposure assessment, hazard controls, and so on, infectious diseases and so on. But there's more of a focus on international issues. For example, some of the topics, to give you a flavor, they range everywhere from heat stress, which we have, but also looking at the effect of NAFTA on worker health,
right,
or supply chains and how that works, disaster management and the impact on occupational populations, and total exposure health, workplace health without borders, and that organization, what they are doing in sort of resource poor conditions. So it is different from AIHC in that regard. So it's really, the focus is not so much on the US and Canada and Europe, but the rest of the world also.
So in particular, what education session are you most looking forward to?
Oh, there are so many. Let me just tell you, there are some PDCs, the Professional Development Conferences, and we have around 19 of them, and they're on a wide range of topics, infectious disease, mathematical modeling, and those that are really relevant to the rest of the world as well. And workplace risk assessment in the 21st century, so we are looking forward. In fact, that's one of the PDCs I'm really looking forward to. In terms of the platform sessions, I'm really interested in the Workplace Health Without Borders. That's an organization I'm personally interested in knowing more about, and I don't think it's got as much attention as really we need to give it. There are some sessions on biohazards and workplace or work policies related to emerging infectious diseases such as Ebola. How are healthcare workers going to deal with any other emerging infectious disease? So that's, I guess, personally, I'm a researcher and a professor. I'm personally interested in learning more about those issues.
Excellent. And you serve on the planning committee for IOHA. As I said, you're the chair of the planning committee. Can you tell us a little bit about that experience? For many of us don't even know what goes into planning a conference.
Well, first of all, I was very surprised and also honored. But first, I was just shocked that anybody would ask me to be the scientific chair of this conference. But the first job that I had to do was assemble a scientific conference team. And so we have an amazing team of people from literally around the globe. So we have members from the US and Canada, of course, but Europe. We have people from South Africa, we have people from Malaysia and Korea, so literally spanning the globe. And they're all sort of very well-known researchers and industrial hygiene practitioners in their own right, in their own countries. We had a wealth of talent, and the difficulty was to boil it down to
Right.
6 or 7 people.
Yes.
But anyway, I think I lucked out in having a great team. We had lots and lots of submissions, and the main, I would say, challenge for our team was to say, okay, how are we going to reduce it down, given that we have a hotel that has so many rooms,
Right.
and we have only so many days. So we had to say no, unfortunately, to quite a few submissions. But I think it's going to be a really high quality conference. That was my first. There are 2 criteria that the scientific conference committee set itself. One is it needs to be high quality no matter what. And the second one, equally important, it cannot be North American centric.
Right.
It needs to be truly global. And so we unfortunately had to turn away a lot of North American submissions so that we could make it a global conference.
Well, it sounds like you have a lot of really interesting sessions that are going to be offered, and I know that I'm looking forward to hopefully getting to attend some. And thank you so much for joining us.
Sure, thank you. And DC is a great place.
Yeah, we hope to see you there.